Hello, friends. Welcome back to our channel. Your kidneys play a crucial role in your health, but daily habits can damage them. In this video, we'll explore 12 common behaviors that harm your kidneys and how to avoid them. Let's dive in and learn how to keep these vital organs healthy. 1. Excessive daily sodium intake. Excessive daily sodium intake, particularly consuming more than 5 grams per day, can severely impact your kidneys. Sodium is a mineral found naturally in many foods, but it's also added to countless processed products. Your body needs some sodium to function, but too much can be harmful. When you eat too much salt, your kidneys must work harder to remove the excess sodium from your bloodstream. This extra effort puts stress on your kidneys over time. High sodium intake also increases blood pressure, which is a leading cause of kidney damage. Your kidneys use a delicate balance of sodium and potassium to pull water across cell walls, a process vital for maintaining fluid balance in your body. Too much sodium disrupts this balance, forcing your kidneys to retain more water. This retention can lead to swelling in your hands, feet, and ankles. Excess sodium directly affects the kidneys and can also contribute to the formation of kidney stones. These painful deposits form when there is too much calcium in the urine, a condition often linked to high sodium intake. Reducing your sodium intake can be challenging because salt is hidden in many foods. Processed foods, canned soups, and restaurant meals are often high in sodium. Reading food labels and cooking more meals at home can help you control your sodium intake. Even small reductions in sodium can benefit your kidneys. Aim to keep your daily intake below 5 grams, ideally closer to 2.3 grams. This change can help protect your kidneys, lower blood pressure, and improve overall health. 2. Regular consumption of sugary beverages. Sugar-sweetened beverages, including sodas, energy drinks, and sweetened teas, pose a significant threat to kidney health. These drinks are loaded with added sugars that can wreak havoc on your body. When you consume these beverages regularly, your blood sugar levels spike rapidly. High blood sugar forces your kidneys into overdrive. They must filter more blood than usual to remove the excess glucose. This increased workload can damage the delicate blood vessels in your kidneys over time. The strain can lead to a condition called hyperfiltration, where the kidneys filter too much blood too quickly. Sugary beverages also contribute to weight gain and obesity. Excess body fat increases inflammation throughout your body, including in your kidneys. This chronic inflammation can damage kidney tissue and impair function. These drinks are often high in fructose, a type of sugar that can increase uric acid levels in your blood. Elevated uric acid is linked to kidney stone formation and may contribute to the progression of chronic kidney disease. 3. Chronic use of NSAIDs like ibuprofen. Non-steroidal anti-inflammatory drugs, such as ibuprofen, are common over-the-counter pain relievers. While they can be effective for short-term use, chronic use can seriously harm your kidneys. NSAIDs work by inhibiting certain enzymes in your body that produce prostaglandins. These substances help regulate blood flow to the kidneys. When you take NSAIDs regularly, you reduce blood flow to your kidneys, potentially leading to ischemia or lack of oxygen. Long-term NSAID use can cause a condition called analgesic nephropathy. This disorder damages the tissue between the kidney tubules, impairing their ability to concentrate urine and remove waste from your blood. NSAIDs can also interfere with the effectiveness of certain blood pressure medications. This interaction can lead to uncontrolled hypertension, a major risk factor for kidney disease. Chronic NSAID use may cause interstitial nephritis, an inflammation of the spaces between kidney tubules. This condition can progress rapidly and lead to acute kidney injury if not addressed promptly. 4. Smoking cigarettes. Smoking cigarettes is often associated with lung cancer and heart disease, but its impact on kidney health is equally severe. Every puff of cigarette smoke introduces a cocktail of harmful chemicals into your bloodstream. These toxins directly damage the blood vessels in your kidneys. Over time, this damage can lead to atherosclerosis or hardening of the arteries. When kidney arteries narrow, blood flow is reduced, starving kidney tissues of oxygen and nutrients. Smoking also increases your blood pressure. High blood pressure is a leading cause of kidney damage, forcing these organs to work harder to filter your blood. This extra strain can lead to glomerulosclerosis, a type of kidney scarring. Smokers are at higher risk of developing protein in their urine, a condition called proteinuria. This is often an early sign of kidney damage and can progress to more severe kidney disease if left unchecked. 5. Heavy alcohol consumption. While moderate alcohol consumption might have some health benefits, heavy drinking can severely damage your kidneys. Consuming more than 2 drinks per day for men, or 1 for women, is considered heavy drinking. Alcohol is a diuretic, meaning it increases urine production. This can lead to dehydration, which forces your kidneys to work harder to maintain fluid balance. Chronic dehydration can cause kidney stones and urinary tract infections. Heavy drinking can also lead to liver disease. When your liver is damaged, it can't filter toxins effectively. This puts extra stress on your kidneys as they try to compensate for the liver's reduced function. Alcohol interferes with the normal hormonal control of kidney function. It can disrupt the production of the antidiuretic hormone, ADH, which helps the body retain water. This disruption can lead to electrolyte imbalances and further strain on the kidneys. 6. Prolonged sitting. Prolonged sitting, especially for more than 8 hours a day, can have a surprising impact on your kidney health. This sedentary behavior, common in office jobs and during leisure time, affects your body in ways you might not expect. When you sit for long periods, blood flow to your kidneys decreases. This reduced circulation can lead to a buildup of waste products in your blood that your kidneys would normally filter out. Over time, this can strain your kidneys and impair their function. Sitting for extended periods also affects your metabolism. It can lead to insulin resistance, where your body's cells don't respond well to insulin. This condition forces your pancreas to produce more insulin, which in turn makes your kidneys work harder to clear it from your blood. To combat these effects, try to break up long periods of sitting with short walks or stretches. Even standing up for a few minutes every hour can help improve blood flow and reduce the strain on your kidneys. 7. Chronic dehydration. Chronic dehydration, often defined as consistently drinking less than 1.5 liters of water per day, can seriously harm your kidneys. Water is crucial for kidney function, and not getting enough can lead to a host of problems. When you're dehydrated, your blood becomes more concentrated. This makes it harder for your kidneys to filter out waste products. Over time, this extra effort can damage the delicate structures in your kidneys responsible for filtration. Lack of water also increases your risk of developing kidney stones. When you're dehydrated, minerals and other substances in your urine become more concentrated, making it easier for them to crystallize and form stones. Chronic dehydration can lead to urinary tract infections. When you don't drink enough water, you urinate less frequently. This allows bacteria to grow and multiply in your urinary tract, potentially leading to infections that can ascend to your kidneys. Dehydration affects your blood pressure. When you're low on fluids, your blood volume decreases, which can lead to a drop in blood pressure. Your body compensates by constricting blood vessels, which can reduce blood flow to your kidneys over time. To avoid these issues, aim to drink water consistently throughout the day. Don't wait until you feel thirsty, as thirst is often a sign that you're already mildly dehydrated. Your urine color can be a good indicator of hydration. It should be pale yellow to clear. 8. Consuming high-protein diets. While protein is essential for health, consuming high-protein diets, more than 2 grams per kilo of body weight, in the long term can strain your kidneys excessively. This is particularly true for people who don't have increased protein needs due to intense physical activity. High protein intake increases the workload on your kidneys. These organs must filter out the waste products of protein metabolism, primarily urea. When you consistently consume large amounts of protein, your kidneys are forced to hyperfiltrate, which can lead to kidney damage over time. Excess protein consumption can lead to metabolic acidosis. This condition occurs when your body produces too much acid as a byproduct of breaking down protein. Your kidneys must work harder to maintain the proper pH balance in your blood, which can stress these organs. A high-protein diet can increase calcium excretion in urine. This loss of calcium not only affects bone health, but also increases the risk of developing kidney stones. Kidney stones can cause severe pain and potentially damage kidney tissue. 9. Regular use of artificial sweeteners. Artificial sweeteners, often touted as a healthier alternative to sugar, may pose unexpected risks to kidney health when used regularly. These sugar substitutes, found in many diet and sugar-free products, can affect your kidneys in subtle but significant ways. Some studies suggest that regular consumption of artificial sweeteners may increase the risk of kidney function decline. The exact mechanism isn't fully understood, but it may be related to how these substances alter your gut microbiome. Changes in gut bacteria can lead to increased inflammation throughout your body, including in your kidneys. Artificial sweeteners might also affect how your body processes glucose. Some research indicates that these substances can lead to glucose intolerance, a precursor to diabetes. Diabetes is a major risk factor for kidney disease, so this indirect effect could have long-term consequences for kidney health. Certain artificial sweeteners, particularly those containing aspartame, break down into compounds that may be harmful in large quantities. One of these compounds, methanol, can convert to formaldehyde in your body. Formaldehyde is a known carcinogen and can potentially damage kidney tissues over time. While more research is needed, it's wise to use artificial sweeteners in moderation. 10. Frequent consumption of processed meats. Frequent consumption of processed meats like bacon, sausages, and deli meats can harm your kidney health. These foods, while convenient and tasty, contain several compounds that can stress your kidneys over time. Processed meats are typically high in sodium, which we know can increase blood pressure and strain the kidneys. But they also contain nitrates and nitrites, preservatives that can convert to nitrosamines in your body. Some studies suggest that nitrosamines may increase the risk of kidney cancer. These meats are often high in saturated fats, which can contribute to obesity and cardiovascular disease. Both of these conditions are risk factors for chronic kidney disease. The excess fat can also lead to increased inflammation in your body, potentially damaging kidney tissue. Processed meats contain high levels of advanced glycation end products, AGEs. These compounds form when meat is cooked at high temperatures or processed. AGEs can accumulate in kidney tissue, leading to oxidative stress and inflammation, which may contribute to kidney dysfunction over time.
The high protein content in processed meats, combined with their other harmful components, can increase the acid load on your kidneys. This forces your kidneys to work harder to maintain the proper pH balance in your blood, potentially leading to metabolic acidosis if consumed in excess.
11. Overuse of antacids containing magnesium. While antacids can provide relief from heartburn and indigestion, overusing those containing magnesium can potentially harm your kidneys. This is especially true for people with existing kidney problems or those at risk of kidney disease. When used excessively, magnesium-containing antacids can lead to hypermagnesemia, which occurs when there's too much magnesium in the blood. Normally, the kidneys filter out excess magnesium, but if they're not functioning properly or are overwhelmed, magnesium levels can build up. High magnesium levels in your blood can cause nausea, vomiting, and muscle weakness. In severe cases, it can lead to cardiac arrest. People with kidney disease are particularly at risk because their kidneys may not be able to remove excess magnesium effectively. Some magnesium-containing antacids also contain aluminum. When used frequently, this combination can lead to a buildup of both minerals in your body. Aluminum accumulation has been linked to bone diseases and neurological problems in people with impaired kidney function. Overuse of these antacids can also mask underlying health issues. Frequent heartburn or indigestion might be a sign of more serious conditions like gastroesophageal reflux disease, GERD, or even stomach ulcers. by relying on antacids instead of seeking medical advice, you might ignore a problem that needs different treatment. 12. Excessive daily caffeine intake. While many people rely on caffeine to get through their day, excessive intake, more than 400 milligrams daily, can potentially harm kidneys. Caffeine, found in coffee, tea, energy drinks, and some sodas, affects the body in ways that can stress the kidneys over time. Caffeine is a diuretic, meaning it increases urine production. If you don't compensate with adequate water intake, this can lead to dehydration. Chronic dehydration puts extra strain on your kidneys as they work to conserve water and maintain electrolyte balance. High caffeine intake can temporarily raise your blood pressure. While this effect is usually short-lived in most people, those with existing hypertension or kidney problems may be more sensitive to these spikes. Over time, repeated blood pressure increases can damage kidney blood vessels. Excessive caffeine consumption has been linked to increased calcium excretion in urine. This calcium loss affects bone health and increases the risk of kidney stone formation, particularly in people already prone to stones. Some studies suggest that high caffeine intake may increase the progression of chronic kidney disease in people who already have reduced kidney function. The exact mechanism isn't fully understood, but it may be related to caffeine's effects on blood pressure and diuresis. Caffeine can interfere with your sleep patterns, especially if consumed late in the day. Poor sleep quality has been associated with increased inflammation in the body, potentially impacting kidney health over time. Thanks for watching. If you found this information helpful, please like and share this video. Don't forget to subscribe to our channel for more health tips. Take care of your kidneys, and they'll take care of you.